Cerebral palsy is a group of disorder that affects the person's ability to move or maintain the balance and posture. Cerebral palsy is the most common motor disability in childhood. Cerebral means having to do with the brain, and palsy means weakness or problem with using the muscle. CP is caused by abnormal brain development or damage to the developing brain that affects the person's ability to control his or her muscle. The symptoms of CP may vary from person to person. A person with severe cerebral palsy might need to use special equipment to be able to walk, or might not be able to walk at all because it needs a lifelong care. A person with mild cerebral palsy, on the other hand, might walk a little awkwardly but might not need any special help. CP does not get worse over time. To be exact, symptoms can change over the person's lifetime.
5 types of cerebral palsy. The first one is spastic cerebral palsy. It is a developmental disorder caused by damage to the brain before birth, during delivery, or within the first few years of life. This condition prevents the normal development of motor function. Spastic cerebral palsy is characterized by jerky movement, muscle tightness, and joint stiffness. Moving on, the second one is atherosclerotic cerebral palsy, also known as dyskinetic cerebral palsy. It is a movement disorder caused by damage to the developing brain. This type of cerebral palsy is characterized by abnormal involuntary movement. Children with atherosclerotic CP fluctuate between hypertonia and hypotonia.
Hypotonic cerebral palsy is classified by low muscle tone that causes loss of strength and firmness, resulting in floppy muscle. Mixed type cerebral palsy occurs when the child exhibits symptoms of more than one type of cerebral palsy that has issues with involuntary movement. Ataxic cerebral palsy is caused by damage to the cerebellum, which is responsible for coordinating physical movement.
They say doctors aren't always able to pinpoint exactly what caused the brain to be damaged or development to be disrupted, resulting in cerebral palsy. The following are some of the issues that might harm the brain or cause it to grow slowly. Number 1, brain bleeding can occur while the kid is still in the womb, during the delivery, or the after. Number 2, a shortage of blood supply to vital organs. Number 3, seizure in the first month of life or a birth. Number 4, some genetic conditions. Number 5, traumatic brain injuries like car accident, a fall, and child abuse, and so on.
What are the symptoms of cerebral palsy? The symptoms of cerebral palsy are not usually obvious just after a baby is born. They normally become noticeable during the first 2 or 3 years of child's life. Possible signs in a child include weak arms or legs, shaking hands or tremors, walking in tiptoes, and muscle spasms. The severity of symptoms varies significantly from child to child. Other symptoms: feeding, drooling, and swallowing difficulties, constipation, seizures, eye problem, hearing loss, abnormally curved spine, and so on.
Now that we know the causes and symptoms of having cerebral palsy, what are the tests that medical professionals do on diagnosing cerebral palsy? There are 3 steps: developmental monitoring, where they trace the child's progress; developmental screening, where they see if the child has developmental delays; and the last one is developmental and medical evaluation, where they evaluate parents on their medical history and some tests so that they can diagnose the specific disorder the child have. In here, they can undergo CT scan, EEG, or MRI. Cerebral palsy is generally diagnosed during 1 or 2 years of the child's birth, but if the symptoms are mild, it can be diagnosed in later years.